right, Dr. R again, going over some Epi questions. Again, can start off with the lead-in, see if you can solve it, what type of health research is being conducted. Cannot solve it, so I'm going to have to come up here to the question stem and look about that. And here, these are the same ones we've been tackling before, different types of research. This one starts off with a hospital administrator. So that's going to be really important. The things that I'm starting to think about are maybe this is a services or a systems. But let's continue on. So a hospital administrator is interested in improving patient outcomes for patients with heart failures. She conducts a study to evaluate the effectiveness of a new care model. So this is a new care model, which is quite important. So that involves a multidisciplinary team. That means the team has multiple different disciplines on it. Like you might have a critical care doc, you might have a primary care doc, you might have a nurse, you might have a social worker on the team. And they're all going to be on that team and taking care of this entire approach. So she measures patient outcomes such as hospital readmissions, length of stay, and mortality rates. These are all actually quite important. So the first ones that I can get rid of, I think, are basic science research, because I'm not looking at the fundamental mechanisms. Clinical research, well, it potentially could be clinical research, but we're really talking about how we're delivering healthcare here, aren't we? We're not necessarily talking about a drug or a treatment or an intervention. So this one to me is unlikely. So there's no treatment or intervention or medication that's really being talked about. Epidemiologic research, are we talking about populations here? We're not really talking about populations or cohorts of people. We're looking at disease in a certain population. So that one's less likely. But how do we differentiate between services research and systems research? So services research. Services research. Are we looking at trying to understand the organization? Maybe the delivery of that organization or that thing, or maybe even the financing. So the delivery or the organization or the financing, I don't really see that. What I really see is that we're taking a systems approach to this. We're looking at a new care model, which means we're trying to create a model to change how the multidisciplinary team approaches patients with heart failure. And the outcomes that we're going to be looking at are things like hospital readmissions, length of stay, and mortality research. So we're really looking at focusing on the health system and how they function. So this is a health system and how it functions. Because we're looking at a care model, we're talking about the hospital system itself, we're looking at trying to decrease hospital readmissions, length of stay, and mortality rates. So we're really trying to look at the entire system as a whole, right? We have a multidisciplinary team. And because we have a multidisciplinary team, there might be nurses, there might be social workers, there might be physicians on this team. And this is more of a systems approach as opposed to focusing on how do we change the organization or the financing or the delivery in order to be able to get the outcomes. So for my money, systems research is the one that seems to make the most sense.